Hello everyone, welcome back to Fire Nursing Tutorial YouTube channel. In this class, we are going to discuss with one of the very important topic, that is brain CT scan. In detail, we are going to study this. Don't skip the class, watch till the end. And then don't even forget to subscribe. First we'll see what is brain CT scan. Here, a brain CT scan is a special type of X-ray, and then that creates detailed images of the brain. It's a type of X-ray, and then that's going to provide the images of brain in detail. And then why it is done? Why is it done? To check for head injury, to detect brain stroke or bleeding, to find brain tumor or swelling, to investigate epilepsy or seizure, and then to evaluate severe headaches or even unconsciousness. We'll discuss. Here we can see the types of brain CT scan. First one is a plain, second one is a contrast, and then third one is a angiography. These are the types. And then you can see a report here. Brain scan report here it is. CT brain. It's in a plain one. Okay. Here little bit we'll see the technique. Plain CT scan was carried out on multi-detector scanner. By using multi-detector scanner, they are going to carry this CT scan. And then axial sections from base of skull to cranial vault were obtained and evaluated. This is a common report I am showing here. You can see the findings and then impression. Findings here, it's a normal one. Both cerebral hemispheres show normal CT attenuation values in plain study. And then comes to the second finding. Basal ganglia and thalami appears normal. Brainstem, cerebellar hemispheres and vermis appear normal. And then there is no midline shift. And then suprasellar regions are normal. Visualized portions of orbits and paranasal sinuses are normal. The impression is that CT brain study is within normal limits. Okay, now we'll discuss what is the thing in abnormal. In case of abnormal, what happens? Okay, first finding is that both cerebral hemispheres, you can see here, first finding, here it is first one, both cerebral hemispheres shows normal CT attenuation values. Okay, it is in a normal we can see brain tissue density, that is attenuation, is balanced, no signs of infraction, that is stroke, bleeding or infection. This is the normal finding. What happens if abnormal cerebral hemispheres? Here you can see in the case of abnormal, stroke, infract, that is only stroke, appears as a low density area, dark area we can see, and then it indicates lack of blood supply. And then next to the second, intracerebral hemorrhage, high density patch showing bleeding, excessive bleeding is present. And then first one is no blood supply, that is dark area we can see. And then next one, cerebral edema, brain swelling or generalized low density we can see. This is the thing in case of abnormal cerebral hemispheres. Okay, next, here only you can see here abnormal means there is no blood supply here, white patches we can see, white area. This one is a normal, this is the abnormal. Next finding is basal ganglia and thalami appear normal. Normal means no mass, no bleeding or ischemia in deep brain structures. But our important thing is that in case of abnormal, basal ganglia and thalami if abnormal, we can see lacunar infract, that is small deep infracts due to diabetes or hypertension, and then calcification. calcification of tumor, here seen as bright spots or irregular mass. This is this in this picture you can see this one is a calcification. There will be the accumulated mass of calcification. And then here thalami, basal ganglia, and then hemorrhage. Here we can see the hemorrhage. This is all about the abnormal basal ganglia and thalami. Next one, third finding is brainstem, cerebellar hemispheres and vermis appear normal. Normal means no swelling, atrophy or lesion is balance and coordination areas. Here, important is that in the case of abnormal brainstem, cerebellum, vermis, cerebellar stroke or hemorrhage we can see, and then cerebral, this one is a cerebellar stroke or hemorrhage. Here we can see the hemorrhage. This one is hemorrhage. Here you can see this arrow mark. This one is a hemorrhage. Cerebellar stroke or hemorrhage, balance issues. Here hemorrhage is there in the sense, there we can see balance issues, swelling in lower brain. And then next, tumor, that is medulloblastoma, astrocytoma, mass with mass effect. Here this one tumor you can see, tumor here, this one is. Next finding is that there is no midline shift. Normal means symmetry between both the brain halves is preserved, and then no mass or pressure we can see. And then here in the case of abnormal midline shift, there is sign of mass effect. Sign of mass effect, tumor, bleed or edema. Brain tissue pushed from one side. Here you can see that in the picture, there will be the pressure causing shift. Next one is basal cystomes are normal. Next finding is basal cystomes are normal. Normal means open fluid filled spaces at brain base are not compressed. There is no compression, no raised intracranial pressure. And then in the case of abnormal basal cystomes, effaced or compressed. That is, it indicates raised intracranial pressure. Here you can see that there will be the intracranial pressure we can see. Blood in basal cystomes. This is on the left and the right. Okay, here you can see that pressure. Sixth finding is cella and supracellular regions are normal. In normal condition, pituitary gland and its surroundings are normal in size and shape. In the case of abnormal, cella and supracellular region. Abnormal, in the case, pituitary adenoma we can say. That is, tumor pressing optic nerves or brain parts. Here, in detail I have shown here. In this picture, you can see, by reading this one, by understanding this, you can clearly come to know. Okay, next one is seventh one, that is skull old appears normal. This is a seventh finding. Here normal in the case skull bone shows no fracture, erosion or abnormal density. But in the case of abnormal skull old, we can see the fractures. That is linear, depressed or complex skull fracture lines. Linear fracture, depressed one, and then complex skull fracture lines we can see here. Okay, in the picture you can see here. Okay, next finding is eighth one, that is visualized portions of orbits and paranasal sinuses are normal. Normal means no fluid, no mass or no fracture in sinus or eye socket area. And then abnormal, in the case of abnormal orbits and paranasal sinus system. Abnormal in the sense we can see the sinusitis, inflammation of sinus. And then here fluid levels, mucosal thickening in sinus cavities. Here it is a normal sinus, you can see in the picture. Here it is an infected one. I hope you all are very clear with the CT scan, brain CT scan. Please like, share and subscribe to my YouTube channel for more informative content. Thank you for watching.